Good morning. My name is Marna Wright. I'm an occupational therapist in home health. I've worked in home health settings since 2014. And if you've seen any of my other videos, you'll know that fall prevention and preventing the injury secondary falls is a passion of mine. So welcome back to Module 5. Today we're going to get right into some of the assessments that you can do to assess and determine whether you or a loved one of yours is at risk for falls. And the one we're going to cover today is the MACH 10 Falls Assessment, which is really the Missouri Alliance for Home Care Falls Assessment. And as you can see, I've started a little grid. As we go along with these, we're going to compare them. So you can make a decision based on your current needs. And I may edit this grid based on other factors that come up. But this is what we have so far. So the MACH 10, it is validated, which means it's been tested and shown that it measures what it's attempting to measure. It's very well known. If you go into any hospital or post-acute setting in the US and say that your MACH 10 score for fall risks is a 6 out of 10, people will know what that means. It's multifactorial, which I love. Remember, fall risk factors are many. Some have to do with our person, some have to do with our environment, and this assesses for both. You can use this as a self-assessment. It is used in post-acute settings for clinicians to assess patients, and a family member could do this, or you can do this simple free PDF paper pencil assessment that you can answer these questions on your own. You don't have to have a clinical background to answer them. It's free, as I said. Go online, find the PDF, print it out. It's very quick. There are 10 questions. It shouldn't take you more than 20 seconds to complete this assessment, and it's very easy. It's easy to score and to interpret the score. So we like it. There it is on the right. And here are some facts about the MACH 10. As I said before, it's well known. People know what the MACH 10 means, and they know what the scores mean. As I said before, it takes just seconds to perform. It's just a check mark next to those 10 items on the right. Am I over the age 65? Do I have 3 or more diagnoses? Do I have a prior history of falls within the last 3 months? Am I incontinent? Do I have visual impairment? Do I have any kind of impaired functional mobility? Do I have environmental hazards? Do I take 4 or more prescriptions of any type? Do I have pain that limits my function? It means it makes it hard to get up. And is there some sort of a cognitive impairment going on? Short-term memory loss, executive functioning, decreased executive functioning skills, which means makes it a little harder to plan things ahead of time and drive. That's it. Those are the items. You can complete this. However, if you have a loved one who does have a cognitive impairment, I suggest you complete it for them or a clinician performs it because they may not answer the other questions as accurately as you could. Multifactorial, we love it, gives us a good, clear clinical picture of where to start. Built in are the areas which you should begin to modify. For example, just so you know, anything over a 4, the total score is 10. Anything over a 4 or greater, means you are at risk for falls. And if, say, you check, yes, I have environmental hazards, yes, I have some visual impairment, yes, I have some pain, well, you know the areas to begin addressing right away to reduce your risk from falls from these factors. The ones that are highlighted in red, especially the top 3, age, diagnoses, and prior history of falls, they are what they are. Those are not modifiable. However, you can be your best health for your age. You can make sure you are seeing your doctor regularly and all your current diagnoses are being treated appropriately. And be honest about falls. Don't be afraid to report falls. Things could be done to help you not fall again and you can remain independent. Incontinence I included because sometimes it is secondary to like a UTI, so it can be modifiable under those conditions. And there's actually some pelvic floor exercises that are out there that you can utilize as well if you're a woman specifically to help with incontinence. I like that you get an immediate result. Oh, I'm a 2 out of 10. Okay, I'm going to test myself in 6 months and see if I remain a 2 out of 10, and I'm going to do what I can for the things that I can modify. Oh, today my score is 6 out of 10. What's going on? I know this right now, and I can start addressing and preventing falls, because remember, the purpose of this series is to help you prevent falls. I've attached a link in the bottom, the free PDF to MACH 10. However, if you just Google Missouri Alliance for Home Care, MACH 10, you can find it in any search result right at the top. Very easy. Print it out and take it. And then take the results to your doctor. Hey, I did a MACH 10 at home. My son or my daughter did this on me. This is our results. What can we do about it? And, start staying safer. Again, thank you. If you watched this whole video, I appreciate you. Also, I hope you learned something. If you have any questions below, you can put them in the comments or you can send them to my email, marnaby243@yahoo.com. Let's learn how to give falls the slip.